As Yeni surgeons, we occasionally come across patients presenting with vague throat pain, a foreign body sensation, or even ear pain that doesn't seem to have an obvious cause. One condition that might be responsible, but is often overlooked, is Eagle syndrome or stylohyoid syndrome. Eagle syndrome occurs due to an elongated styloid process or mineralization of the stylohyoid ligament. Normally, the styloid process is around 2.5 centimeters in length, but if it exceeds 4 centimeters, it's considered elongated. While this anatomical variation is found in about 4% of the population, only a small fraction of those individuals actually develop symptoms. Clinically, patients may present with dull pharyngeal pain, often localized in the tonsillar fossa, which may radiate to the ipsilateral ear. Some experience odynophagia or even a persistent foreign body sensation. On examination, the styloid process may be palpable in the tonsillar fossa, and pressing on it can sometimes reproduce the patient's symptoms. Radiological diagnosis is key, either using orthopantomography or a CT scan. A CT with 3D reconstruction is particularly useful for surgical planning. The symptoms are thought to arise from compression of surrounding structures, such as impingement on the hypoglossal nerve, irritation of the carotid artery, or inflammation at the insertion of the stylohyoid ligament. Interestingly, when Eagle first described this syndrome in 1937, he linked it primarily to post-tonsillectomy changes, but later studies have shown that tonsillectomy is not always a causative factor. Despite clear clinical cases, Eagle syndrome remains controversial. In fact, the International Headache Society has dismissed it as not sufficiently demonstrated. This skepticism can sometimes lead to underdiagnosis, leaving patients without proper treatment. For symptomatic patients, conservative management can be attempted, including steroid therapy and local anesthetic injections, which can provide temporary relief. However, for persistent or severe cases, the definitive treatment is surgical excision of the elongated styloid process. Surgery can be performed via two approaches: a transoral approach through the tonsillar fossa, which avoids external scarring but has limited visibility, and an external transcervical approach, which provides better exposure but leaves a scar. Both methods have their advantages, and the choice depends on individual patient factors and surgeon preference. In summary, while Eagle syndrome is rare, it should be considered in patients with persistent throat pain, otalgia, or foreign body sensation without an obvious cause. With proper imaging and clinical suspicion, we can diagnose and manage this condition effectively, offering our patients much-needed relief.